Welcome back. I'm still joined by Health Ombud Professor Malegapuru Mkoba, who's with me here in the studio. We're talking about the Life Esidimeni tragedy. We'll also be looking at other health situations throughout the country. And the one question, though, Prof, is whether Gauteng was the odd province out when it comes to the care of mentally disabled patients, as we saw through the Life Esidimeni experience.
I think one should say that in the affirmative. I think it was the one, it stood out. But remember that lots of things stand out in Gauteng anyway. I mean, even now, I've received close to 2,000 complaints. About 800 of those are from Gauteng. It just tells you, I think, the level of activity around complaints in Gauteng, in health alone. So it did stand out. But nevertheless, I think there are many Life Esidimenis that are taking place throughout our country. I'm leaving next week to go to the Eastern Cape to look at a potential Life Esidimeni somewhere in Fort Beaufort. I'm going to spend the whole week there. So there are a few of them. I think, as you know, there is the oncology problem in KZN.
Sure.
There is also an oncology problem that is being looked after now by the Human Rights Commission in Steve Biko academic hospitals. So there are these little problems that are all about human rights abuse, the lack of respecting human dignity, the lack of providing access to information around health and continued health, poor continued health. But sometimes something that has come out is the rudeness of the health professional towards patients. That's something new that I don't understand. And it's beginning to surprise us. And sometimes we are told that we're old-fashioned because we're older, especially from the young doctors and the young nurses. But really, there is a culture of rudeness that the patients are experiencing all the time when they visit these health establishments or clinics or whatever. And that is a new element that we need to deal with.
It's a culture, as you refer to it, right? And there are norms, there are standards. There's the ethos of the whole medical sector and what patients should expect from healthcare professionals. So, I mean, how is that justifiable from those that you are interacting with? Where does it come from, you think, anyway?
I don't know. I don't know whether it's a culture that is associated with materialism, lack of, you know, we used to see the medical profession or the health profession as a vocation, as a calling. I think now it has become like every other career. It's there to make money. And to
it's a hustle, maybe people call it that.
Yeah, it's a hustle. People try to make money, they get rich out of it and so forth. I think that has moved as the world has become more material. But in South Africa, remember that we are starting from a low base, and when that happens, sometimes it is not coordinated in a very good way. I mean, development at its best is very slow, but sometimes it gets overtaken by globalization, and people are ahead of things that they shouldn't be doing. And maybe we are confused in that milieu, such that our young doctors have become more materialistic than the older ones, and they are more impatient about getting rich. They are more impatient even with patients. And that's not a very good cocktail to have. I mean, I hear the minister often talks about it. I wish he wouldn't do it. Other people should do it for him. But nevertheless, he does talk about it, that there is this new culture that is frustrating all of us here in the health profession.
Now, let me go back to the investigations that you're going to conduct in the Eastern Cape. What is the basis of the complaints? What exactly are you going to do?
The most interesting thing about this one is that actually a doctor, a senior doctor, has lodged complaints about human rights abuse in a hospital where he used to work. That's the intrigue. Yes. How can an employee, a senior doctor, come and lodge a complaints about human rights abuses when he has been part of the system? But that's really the hub-nub of what I'm going to be investigating.
Sure, and we'll await the outcomes of your investigations. Today is World Cancer Day around the world, but the situation in South Africa is nothing to be proud of. If we cite the example of KwaZulu-Natal, for instance, where we learn there's only one oncologist, if my understanding is correct, and dozens and dozens of patients who are not receiving any care there.
Yeah, well, I think that's, that work was done excellently by the South African Human Rights Commission. I think they did that. They consulted with my office and I gave them inputs. I think the MEC has been called to appear in front of the Human Rights Commission, and I think he did that maybe on the 15th of this past month. And there seems to be a process of trying to rescue the situation. I think they are now getting some assistance from the Gauteng province. They've bought some new equipment. I think the National Department has come to the party. So something is happening, but nevertheless, it requires a disaster for us to realize that there is a problem. I mean, the whole purpose of medicine is being preventive. Yeah.
But to go to your question, how do things get to that stage where we have to implement emergency interventions?
Well, it seems to be the culture of South Africa. We are in an emergency, crisis mode all the time, whether it's government, whether it is the health service, whether it is SASA, everything is urgent here, and something has to go terribly wrong for us to wake up and realize, actually, we are human beings, we love each other, we have a country that we need to govern, but we always seem to fall back again for something disastrous to assist us to recognize and to bring our consciousness to issues. I don't understand that. Whether it's a history of suffering, of oppression, I don't know.
Well, again, I'm not happy myself asking these questions and citing instances. Yeah. What we saw earlier this week at Charlotte Maxeke Hospital, for instance, where patients were prevented from entering the hospital, those who were coming for outpatient care, including the ambulances that were delivering those in emergency situations. What did you think? What did you think when you saw what was going on at the hospital?
First of all, I didn't see it. I heard about it. But I also heard, I understand that the minister used some very strong words about it. But really, I think, the life of patients cannot be compared with the disagreements we have between workers and employees. I mean, when we worked during the apartheid era, when we were young doctors, we could complain. There were many issues we could have gone on strike on, but the life of the patients was paramount to our calling, to look after them. We never did anything that would cross that line. Now, that it has crossed the line in South Africa is part of the culture I was talking about, where the value of human life has gone so devalued that actually we can strike on that value that was so sacrosanct in the profession itself. And remember that the people who are striking were all happy. It's an employer and employee. The people that are suffering, who can die and disappear from us, have got nothing to say. They've got no power. They are dependent wholly on us. And we don't seem to take that as serious as it should be. I think that is the most shocking thing that we're seeing, that is emerging and evolving in our own country as we are creating this so-called democratic, non-sexist, non-racial South Africa, that it seemingly is becoming very dangerous to its own citizens.
Now, in your line of work, you come across so many depressing instances, and it's your duty and responsibility to try and correct that. But overall, what do you think is the state of healthcare in South Africa, and any recommendations that you've been thinking about?
Well, I think the state of healthcare, to sum it up by many other people, it's collapsing. It's collapsing. And I think many people and many studies have identified 4 things that are missing there. Infrastructure is collapsing. Human resources, it's deficient. I think governance, the leadership governance of the hospitals is and as I say, the work ethic of the staff is also collapsing. Those are the things that needs to be corrected. I believe that the best recommendation I can make is for the national minister to meet, I think, with a group of people, women, young people, or young doctors, or young professionals, older professionals, to come up with a new way of looking at healthcare in the country in a very comprehensive manner. There will never be enough budget. You know, the NHS, it's 70 years old. You know?
You mean in the UK? Right?
Yeah. It was established to provide universal health care. It does that extremely well, but it still has numerous financial problems. We are trying to start the same thing here in South Africa. Instead of starting it, we are busy fighting each other as if we don't understand that people should have universal health coverage. We are fighting as to whether it should start or not. There's an example of a situation in the UK where it has worked for 70 years. I lived there for 16 years of my life, and I benefited by being part of that. And I don't see how...
So now, at least we've got the office of the Health Ombud, which you had.
It is an office.
Yeah.
One person, I'm not Jesus Christ.
Oh, you don't have people with...
I'm not Jesus Christ.
Yeah.
I'm William Mkoba.
Yes. Okay, I thought maybe you've got a huge staff complement, but be that as it may. There's something you referred to earlier on of accountability.
Yeah.
To the extent that people were asking, where's the Minister of Health when this happens and that happens? What are your thoughts on the way healthcare is structured, the governance of healthcare is structured in the country?
Well, that's precisely what I was saying about the national healthcare, the constitution, the provincial powers. I think they need to be realigned. But the minister, the national minister of health, needs to appoint the ministers that are in the provinces so that he can have control over them, he can guide them, he can lead them, or they can at least discuss together as to the status of health in the country. At the moment, they can't do that. The ministers are appointed by the premiers. Sometimes the premiers don't even know much about health, but they appoint these ministers who report to them, and sometimes they don't understand what is being reported. I mean, the situation in the Northwest maybe is the latest of all of these things where obviously neither the premier or the former premier understood anything about health. And we've had the corruption that is alleged to have taken place there. And now we've had to send in the military. The very same military that can't look after its own doctors in the military. Now they must go and look after patients in a hospital. I mean...
So, as we conclude, healthcare
is in a mess. It's in a mess, and it requires very strong leadership, but that leadership requires a lot of consultation. Sure. There's a lot of wisdom within the country, and that should be used, I think, effectively by the national minister.
Prof, I appreciated your time and your insights. Thank you very much for spending time with me.
No, thank you very much, Tim.
That's Professor Malegapuru Mkoba. He's the Health Ombud, sharing with us his experiences as he goes through his work and, of course, as we've learned, shocking state of affairs in the healthcare system. I hope that Mr. Themba Godi will have some uplifting news to share with us, but I doubt very much he'll be joining us in a moment.